worked like crazy through 2007 and 2008 to actually win an election for a change. And really didn't want to win just to dominate everybody else who disagreed with anything I thought. That wasn't my intention. I don't think it was yours. But I think I represent at least numbers of my friends and family who feel bullied and overshouted, having worked very hard. And I guess I have two questions. One is, I'm a sociologist, so I come at this from that perspective. And one of the precepts in sociology is whoever gets to frame the argument wins the argument. And it seems to me recently one of my great disappointments is that even though I've heard Jerry Polis privately and you, some on your website and others, have very intelligent conversations about healthcare, it doesn't seem like those are the voices that are getting to frame the argument of the public. So I'm not surprised that the polls are changing, because I don't think people are really hearing the arguments that need to be made. So my first question is, how do you purport to change that dynamic and get the real conversations to the public so that we can have serious conversations? I mean, I'm talking to my friends at Christian Right, and I've gone to an evangelical college, and we're sitting there saying, you know, as Christians, we believe everybody should be covered. And they have big concerns about fiscal responsibility, understanding, yeah, but I'm hearing all this stuff. But when we talk to each other, we're talking as friends who care about each other, who know each other, and who know we want the public good. That conversation, it's like, how do we get it to another level? And I guess my second question is attached to the Senate, and that is, how do we not, because of the way the Senate and House are set up differently, how do we not get constrained by the limitations in the Senate that have a few senators from very small states that do not have some of the huge healthcare problems that the large states do, holding us all hostage? What can you do for us?
I've been in Congress now 13 years, believe it or not. The one thing I've learned is never try to figure out what's going on over there in other countries. But having said that, this is, I think the media likes to cover, in the past, and I'm not saying this was a positive way to legislate, but in the olden days, before the 24-hour news cycle, the way legislation got made was a whole bunch of people would go into some room in the Capitol and they do their thing, and then they'd come out with a bill, and then there'd be an article in the newspaper and a report on the evening news. Now, with the 24-hour news cycle, someone emerges from a meeting and you see it. So-and-so looks glum. Well, I think that, I actually, it's all moment to moment. And so, what I say to people is, look, as you'll recall from your high school civics classes, it takes 3 bodies. The process is 3 bodies: the House, the Senate, and the President. And so what's going to happen is the House will pass its version. I will say that I think that a bill fairly similar to the one we passed out of the Energy and Commerce Committee will probably be the bill in the House. And I can guarantee you that a bill will not pass out of the House without a public option or several alternatives. Irrespective of what you read in the media or what individuals in the administration or the Senate or wherever might say. The reason is because, I'm also Chief Deputy Whip for the Democrats. I'm in charge of counting the votes. And I don't think we can pass a bill. In fact, I can guarantee you we can't pass a bill that doesn't have those features to it. So the House will pass its version, and then the Senate will pass a version. But some of the people in this room will like the Senate version. Most of you will not like the Senate version. But that doesn't mean that it's over. What happens after that is that the bill goes to the conference committee, and that's where the final details of the legislation will be hammered out. And that conference committee has House and Senate conferees. So, and we're working with the White House all along with this, all along. The President has said, and I think rightly so, that Congress is in charge of legislating. And so the President needs to let us work this committee through. That goes back to your first question about how can we change the conversation. And I actually think the conversation is changing now. What happened was, and you know what, I think this is an important national conversation to have, because we're talking about restructuring the healthcare system of our country. And we've been limping along. People say, why are we moving so fast? And say, well, we're not moving fast if you think about the fact that for 50 years, every president has talked about doing something, that the situation is getting worse and worse. An increasing percentage of our gross national product is going towards healthcare costs, but yet we're the 29th country in terms of healthcare results in the world, according to the World Health Organization. So clearly, it's something that we have to address. And I will say that I've been working on this. I've been on this committee for 13 years. I've been working on healthcare issues for a long time. So I know what's going on in this bill. Most of my colleagues who are not on that committee didn't really know the nitpicky details of the bill. And so I think, when everyone came back in the August recess, and some of the opponents of doing anything started demagoguing the issue and started, frankly, making scary and untrue statements, it really woke everybody up, and it made everybody start to think about, what do we really want to do with our healthcare system? What do we want to have? And that's the great thing about our country. So look at this conversation we're having today. This conversation, and I had another one in April, and I'm going to have another one in a couple of weeks, as well as a lot of telephone town hall meetings, and radio and TV, and other kinds of opportunities to talk. The conversation we've had today is about 1,000% more productive and detail-oriented than it would have been if we had had it on August 1st. Because people are now studying the bill, learning the situation, and I expect this may go on throughout the fall. It's messy, it's painful,